Have you seen an increase in vasectomy reversal requests?
I think that there has been an increase in vasectomy reversal requests. Some of that is related to the divorce rate, but some of that is also related to change in circumstance of a couple that already has children and decided to have a vasectomy and realized later that they really did want to have another child. And occasionally, sadly, it may be due to the death of a child. I'm also seeing more requests for vasectomy reversals as opposed to the alternative, which is sperm extraction with in vitro fertility, because during the pandemic, in vitro fertility was put on pause. And so couples who were considering the choice between extracting sperm and using that for in vitro fertility versus reversing the vasectomy were sort of forced into making that choice because of the lack of availability of in vitro fertility. Also, vasectomy reversal tends to be quite a bit less expensive than the in vitro fertility process. And with the severity of the pandemic's effects on a lot of people's economic situation, that too has been a deciding factor in guiding couples more towards vasectomy reversal.
That makes a lot of sense. Although the typical thing you kind of hear about with men, anytime you talk about a surgical procedure on their most sensitive body part, they kind of get a little squeamish. So, does it seems that to convince someone first to do the vasectomy and then to do the reversal might be a difficult conversation. Or do you not see that at all? Because once they've done the vasectomy, they know that it's not that big of a deal and are willing to do the reversal?
No, guys are pretty loath to put their guys under the knife. However, when you're talking about having a baby after a vasectomy, one way or another, something's going to have to happen down there. What I am happy to tell my patients is that the vast majority of my patients who undergo a vasectomy reversal report back to me that their recovery was really not that much different than the recovery from a vasectomy. Now, the operation is quite a bit more involved. The incisions are bigger, but the way I perform it and the way I put local anesthesia in at the end before they awaken typically allows them to recover with not much difference in discomfort or disability. And they're usually able to get back to most of their routine activities about as quickly. Now, I do have them refrain from sex or exercise for about 3 or 4 weeks just to really baby those connections. But as far as how they feel and how they're doing, they report back in many cases that it's similar, and even in some cases that it was less painful than their vasectomy.